education, and research that was designed to fill the gap left by the absence of face-to-face meetings, courses, and other activities during the 2020 coronavirus pandemic. But Pioneer has become so much more than this in the intervening year. Pioneer is a virtual, but also very real community of like-minded orthopedists striving to help not only themselves, but one another. With the latest video conferencing and educational technology, as well as a groundbreaking online platform, SICOT's Pioneer events, activities, and resources. With over 55,000 views of our webinars so far. We're forging new partnerships, signing agreements with 12 other international academic societies, and building an enduring network we hope will last for many years to come. So, what can you expect from us? Free webinars led by key opinion leaders from around the world and across all fields of orthopedic surgery and traumatology, as well as chat shows with some of the most interesting and inspiring surgeons on the planet. Opportunities to take an interactive role in these webinars by participating in polls and live discussions. Free on-demand Pioneer playback service. Watch our webinars again and again in your own time. And coming soon, our new bespoke learning management system will host podcasts, an online version of the famous SICOT diploma exam, virtual training modules, SICOT diploma exam, virtual training modules, surgical technique courses, a discussion forum, and much more. We hope you'll join us on this pioneering journey as we push the boundaries of what is possible in online orthopedic education together.
Right. Very good morning, good afternoon, and good evening, ladies and gents. I'm Vikas Kanduja. I'm a consultant orthopedic surgeon in Cambridge, UK, and one of the founders of SICOT Pioneer, and currently the president of SICOT. And it's an absolute pleasure to welcome all of you logging into this webinar from all around the world. Now, SICOT Pioneer was actually born out of necessity during COVID-19 as a small platform, and it's absolutely grown enormously over the last few years. We've embraced the digital future for SICOT, and through this platform, we've done over 100 events, just celebrated our centenary event, and have had over 130,000 views from 120 countries around the world. So big thank you for joining in and following us through our journey. Now, today's webinar is actually focused on thriving under pressure, focused on well-being and resilience. And I'm extremely grateful to our Young Surgeons Committee, ex-chair Aju Bosco, and the present chair, Anna, from the States, who actually got a fantastic faculty and put a stellar program for the next hour for you. So without much further ado, I'm going to hand it over to Anna and to Aju to take over the proceedings. And if you can't make it today, then we do have this available online for you, and you can watch it later. Once again, a big thank you, and hope you enjoy the webinar. Thank you very much. Anna and Aju, over to you.
Thank you, Vikas, for the wonderful introduction. And today we are going to talk about a very important topic, that is stress and work-life imbalance, which are common causes of early burnout among orthopedic surgeons. As surgeons, be it early, middle, or advanced career, we have to navigate between and amidst stressful surgeries and networking, and often we find it very stressful and we fail to strike a balance. So today we have a star-studded faculty of a mix of young, mid-career, and experienced surgeons. And I welcome you all and looking forward to have a great discussion from you. And without any further delay, let me introduce the first speaker and call him to deliver his talk, The Orthopaedic Pressure Cooker, Acknowledging the Unique Stressors. Professor Ram Chaddha, past President, Indian Orthopaedic Association and past President, Association of Spine Surgeons of India. Welcome, Professor Ram Chaddha.
Professor Chaddha hasn't joined yet.
Okay. So we'll move on to the next speaker.
Tross.
Yes.
Dr. Tross.
Yeah, we'll move on to the next speaker and Dr. Samantha Tross, who will be talking on in-the-moment stress management techniques for high-pressure situations. Welcome, Dr. Tross. Dr. Tross is here?
I'm here.
Yeah.
Good. Hello, everyone. Thank you very much. Let me just get my presentation up to share. One moment. There we go. Can you see it?
Yeah, we can see it.
Yeah, that's good.
Thank you. Thank you very much, and hello to everyone. Welcome. So you've seen the topic of my talk. Let's get into it. So what is stress? Stress is a mental, biochemical, and physical response to a fear, perceived threat, or feeling out of control. And that is augmented in a high-pressure situation. The stimulus of stress leads to a release of cortisol, adrenaline, and noradrenaline. And what that does is it leads to a significant energy release and increased alertness. But if that stressful stimulus continues over a prolonged period of time, then that alertness and your energy will decrease. During the release of the adrenaline, it leads to increased heart rate, respiratory rate, and blood pressure. And all of these things can lead to a lack of sleep, anxiety, anger, illness, chronic pain. And if you're having those symptoms, then you're not going to perform at your best. Now, Professor David Williams, who's a professor of sociology, African American studies, and behavior at Harvard University, he looked at stress in relation to discrimination. And he found that those that are affected with discrimination had a higher rate of heart disease, lower life expectancy, and an increase in mental illness. And that can be extrapolated to any form of stress. So the long-term impact is that's going to affect your decision-making. It's going to impact the way that you look after your patients and patient care. It's what it's all about, your relationships and your well-being. So it's very, very important that you get on top of managing this. There's my next slide not moving along. Hold on a second there. Right. So how do you deal with the stressful situations? You need to be prepared. You need to remain calm under pressure. You need to be able to focus on the problem at hand, regulate your emotions, and build resilience. And I talk to you a little more on how you will do that. You need to plan ahead. The dealing with a stressful situation starts from before the event occurs. You need to be anticipating potential pitfalls. When you're doing a particular surgical procedure, you're going to be thinking about what can potentially go wrong and what you're going to do should that happen. You're going to think about your colleagues that you're working with. You're going to spend time doing less talking and more listening, studying them, so that you know that you can anticipate how they may react in a certain situation. And should there be conflict, you can then decide what's the best way that you can deal with that situation to make it a win-win for both parties. You're going to develop a routine when you're doing your surgical procedures. If you do something routinely, then when you're under pressure, you're less likely to forget something and cause a problem. You're going to get your work done in a timely manner. Don't leave it until the next day. Because if you are not stressed before an unexpected event occurs, then you have more reserve. So, get your tasks done, set early goals, do the early things first to give yourself a boost that you've had a sense of achievement and so on. So be prepared. That's the key. Then when you are faced with that situation, you're going to take a pause. Take time to breathe. That, as I said to you, the adrenaline needs to increase in respiratory rate. You want to take deep breaths, get some oxygen going to the brain so you can think clearly. You're going to be able to learn to meditate. And this is something you need to practice about, being mindful, being able to focus in on a particular situation at the time and not be distracted by other events. And that takes practice. And if you can feel your muscles tensing up, try to relax as best as you can. Not easy in a stressful situation, but those are some steps. So to remain focused, really focus on the task at hand. You're doing a procedure, there's an unexpected, let's say you're operating around the hip, an unexpected arterial bleed. Not a time to panic. You think about what needs to be done. There's a bleed. You're going to put some pressure, some tamponade. You're going to then expose and try and look for the blood vessel, and you're going to try and tie it off. You can alert the anesthetist that there's a problem, and you may need to call for help. But you focus on the situation. You don't get carried away thinking, oh my goodness, what's going to happen to the patient, etc. Now, another technique is very useful is visualization. Not one that I use personally, but I've told is very useful. If you can visualize yourself in a positive way, having a positive outcome in that particular situation, that can boost your energy and help you feel confident. But I find self-affirmation is very helpful. You say to yourself, you've got this. That is something that I find that's useful. And when you speak positively to yourself, it increases your energy. Negative thoughts leads to depression in energy. To regulate your emotions, you need to, at the moment, obviously it's going to be emotional, but that's not the time for it. It's not a time to be emotional. You have to try and keep that under control. But later on, it's very important that you do acknowledge those emotions and you do deal with them. But at the time, you want to focus on the present and you need to remain objective. Now, if this stress is due to a conflict, focus in on that situation at that moment in time. Don't bring in anything from the past. Just deal with what's happening right there at the present moment. Sometimes you need to seek an opinion for someone to give you something that's subjective. And that's where support groups are important, where you can rely on someone to give you valuable and trusted advice. And then you try to reframe your perspective. If you can think of that situation as a potential for learning and trying to see what you can get out of it, it changes the impact that it has on you. So try and reframe your perspective on it. And then afterwards, when it's all done and dusted, that's the time really to deal with those emotions. You reflect on the situation that's taken place. Celebrate the positive things, yeah? Think about what is done well and really feel good about it. And if things haven't gone so well, don't be hard on yourself. You have an opportunity to learn from that so that you don't make a mistake in the future. So for me, I would say the key takeaways are preparation is key. It's what you do before the stressful situation that's important. And remember that everyone has the responsibility for any given situation. You can decide how you respond in that situation. Nobody else can make you feel a certain way. So you have that power and don't give that away to anybody else. Remember that self-care and balance is very important, because if you're feeling well and good in yourself, then you're more likely to have that resilience and ability to cope with the stressful situation when you're faced with it. Don't accept the status quo and don't be afraid to speak up. But remember, speaking up does have consequences. But by thinking ahead and knowing the people that you're dealing with and you've done some observation, then you know the best way to frame whatever it is you want to say in a way that is a win-win for everybody. And change that relationship that you have with adversity and fear. It's really an opportunity for growth and learning. And remember, please stay calm, because things are never as bad as they appear. Thank you very much.
Thank you so much. That was a great talk, and I have a few questions after, which we can go over in the discussion section. So next, we're going to hear from Dr. Ana Serrano-Ardila, recognizing the red flags, early signs of burnout in self and others, which I think is so key as you are looking introspectively, but also trying to look out for your colleagues. So Dr. Serrano, are we ready to go?
Hi, how are you? Yes, I'm ready. Can I have the permission to share the screen?
Let's see, can our...
Thank you. Now I can do it. Okay, so I'm going to talk about recognizing red flags, early signs, and burnout.
Oh, sorry, you're in presentation mode, I think.
Okay, let me see. Is now okay?
I think you want to I'm trying to see who's better at PowerPoint. Yeah.
Wait.
Like just to go as a slideshow.
Yeah. Let me see.
And they are the people that are actually sitting next to us. And peer support is very different from mentorship because of the shared vulnerability and experience. For example, young surgeons, the challenges, the experiences, and there is no one else that understands young surgeons more than young surgeons themselves. So we, by talking to other people, we can create that safe space for discussion, celebration, and complaints. And you don't have to, worry about talking to your boss or your very senior mentor, how they would judge you. And they also provide you with that sanity check in case you have a lot of difficulties in work. And this is us, all orthopedic surgeons, spending time outside of work, doing sports. And so that actually keeps us sane during work. And as part of the Young Surgeon Committee at the Hong Kong Academy of Medicine, we always have these well-being, initiatives to help doctors cope with stress and also, to provide support to each other. So for conclusion, connection is all power to connect with, people around us. And it's important to remember that we're not alone. And for mentorships, we have to build our own board of directors. Don't just aim for one single person. And for peer support, remember to lean on the peers in the trenches with you. And here are my social details and my contact details. I look forward to connect with you all in some other occasions. Thank you very much.
That was a very insightful talk, Marvin, on the value of mentorship and the importance of peer support. And we'll keep the questions at the end. And may I invite, thanks, Marvin. May I invite the next speaker, Dr. Amit Joshi from Nepal, to talk on Beyond the OR, the crucial role of work-life integration and boundaries. Welcome, Dr. Joshi.
Is my slide visible?
Yes, visible.
Please?
Yes, all good.
Welcome to this webinar. Just hold on. There is some. Okay, there you go. I'm sorry. Okay, is it visible now? Everybody, welcome
Yes.
to this webinar. I am Dr. Okay, so you see, I'm Dr. Amit Joshi from Nepal, probably from one of the low middle income country. And then you see, because of the country's status itself, there is a lot of stresses undergoing on the orthopedic surgeons. So what I'm going to talk today is the crucial role of work-life integrations and the boundaries. You can't hear me?
Yeah, we can hear you. Yes.
Here's some of my practical tips, how I do my work-life balancing. So let us start with the impact of burnout. Am I audible?
Yes, you're audible.
Okay, was my slide moving? Was there any problem in the slides?
Everything was fine.
We could hear you a recording.
Okay, that is what. Let me come back to you. Okay, there you go. Now it should be all right now. Am I audible now?
Yes.
Yes.
Okay, so namaste everybody. I'm Dr. Amit Joshi from Nepal. Probably one of the faculty from low middle income country where we have our own stresses, own problem that cause more burnout to the orthopedic surgeon. So what I'm going to talk today is how I manage this burnout. What is the crucial role of work-life integration and the boundaries. So the objective of my presentation, I have outlined into three groups. First, I'll discuss about what are the impacts of burnout. Then I'll little bit talk about work-life integration. What are the principles and the theories, how you manage that? And probably at the end, I'll take some liberty to talk about how I practically manage my work and my personal life. So let's start with the impact of the burnout. If you see work and life, they try to push each other all the time. And if you are a surgeon who is always working in a stressful environment, if you are not able to maintain this work-life balance, you'll fall into a lot of trouble, which will create problem. The highest level creates lots of mental and the physical. The highest level creates lots of mental and the physical exhaustion. And because of this exhaustion, we feel that we are having the burnout in our career or burnout in our attitude. So what this burnout does, burnout affects in both the places. It has consequences at home and it has consequences at the office. So if it is at the home, you may miss important life events, which are very, very crucial. There is less time with the family. Even if you try to spend some time with the family, this time spent was not very much, fruitful, and they are sometimes ruined. And if you see the consequences at the office, there is a poor morale, there is a high turnover, there is a burnout, and the poor productivity. And none of these effects are good for a practicing surgeon. So as one of our faculty very elegantly described this, the burnout, the common symptoms are chronic fatigue and irritability, cynicism, decreased job satisfaction, and higher error rates. And then all of us might have undergone these stressful symptoms or felt these stressful symptoms during our, clinical practice. This is one of the most recent study I could find out, which was published in 2025 in the Hospital for Special Surgeries. And then they have compared the burnout rates of orthopedic surgeon in 2019 and 2023. And you will be surprised to know that the burnout incidence and the rate in orthopedic surgeon has increased threefold in these 4 years. So this burnout and the problem of managing your life and work balance is going to be a big problem in future as well. So what are the theories of work-life balance or work-life integration? There are several theories, or several ways of managing them. There are restrictive approach involving more and more people to solve your problem. There are boundaries approach, which is quite popular a few years ago. And now we are talking about integrated approach, which is work-life integration. So the barrier approach, which was quite popular a few years ago, in this barrier approach, we were taught to create a rigid barrier between work and life. And work and life were asked to considered as a competing priority. So we were taught to, or we were asked to separate the work and separate the life, which was not practically possible because work is also your life and life is also your work. So that's why there is an integration principle. So you have some boundaries of your life and work, but these boundaries are not very rigid now, they are permeable. So one part of your life will have some portion occupied in your work, and one part of your work will have occupied by some part of your life. And in this concept, work and life should complement each other rather than restrict each other. So what are the strategies to manage the balance your work and life? I have 10 tips. These are the practical tips that I have been following for some years. I just want to share with you guys. Number one, do regular exercises. We all know the benefit of doing exercises, but my point is do exercise with your family members. This is when I went to a morning walk with my wife, So you go at least once or twice or thrice a week in the morning walk with your wife or your kids. And then on the road, when you are free, you talk about your life, you talk about your work, share your problems. And probably this is the beautiful time you spend throughout the day because you don't have any stress. You're doing exercises also, and you are involving your family into your work problem, and you are informing your family about your life problem. Another important fact is make your time between the surgery. When you are working, don't think that you're just working. In between the surgery, whenever you have time, give a social call to your friend, call to your father, call to your mother, give 5 minutes to any of the, family members, give a call. You can do some of your academic works between your, surgical time. Do chatting and gossiping with your friend, having a cup of coffee or some biscuits is always beneficial when you have, have a very busy schedule, because I'm sure we all orthopedic surgeons, we understand that there are times available between the work, So try to maximum utilization of this work is very, very important. Another thing I always suggest to my younger colleagues is plan your future commitment with your family, plan future commitment of next week, month and year, because your family member, they know that what are lined up, and they can also plan, suppose I'm going somewhere, they can also plan to visit some other places or accompany me to go to that places. So it's very important what is lined up in your work has to be shared with your family member, has to be shared with your, all the members, so that they are also aware about your business. They are also aware about your work. This is just an example, how I combine my academic trip with the vacation. So I was still preparing my presentation, which is lined up next day. But you see on the background, my two daughters, they are enjoying their swimming in the hotel, and myself and my wife were talking. So whenever I'm going for a conference, which is quite frequent, I always take 1 or 2 day extra leave and go with my family, so that I can, after the hectic conference, I can enjoy with my family, which is very good refreshment, not only for me, for all of my family members. Organizing small ceremonies at the office and home are always beneficial. If you have, some misunderstanding between your colleagues and the junior colleagues and the operation staffs, anyone, just have a cup of tea and cut some cakes in some occasion. When you have a big team, you'll find out an occasion to organize wherever you want, either in the office or at the home. This will sort out a lot of stress that is there, not only with you, but with your colleagues, with your fellows and the youngsters. I create a boundary on the weekends. Weekends are basically for my families, but it is not always possible, because all weekdays we are working. Weekends are for the conferences, meetings and everything, but try to manage your weekends and dedicate that weekends to your family, which is very, very essential for the management, for the balancing of your work and the life. Involve your family member with your work plan, So what you are doing, your family should know. How stressful it is, your family should know. So whenever you are discussing something, try to involve them. You see, in one of the picture, my daughter is trying to triangulate in the arthroscopy. She knows now what is arthroscopy, how it is done. And then she also says that arthroscopy is a little difficult than the other surgery that she realized. So try to let your family member also understand what is the stressful situation you are working on. Be involved in the family work. There is no harm on making a small breakfast for your family, give a surprise to your family members. This will create a lot of good and the huge positive vibes, not only inside you, but also into your family. That is how you integrate your work and the life in the family. However, there is a need creating a boundary. The pressure, the stress that you get from your work should not hamper your day-to-day office, day-to-day home life. So if you have a bad day in the office, you should not carry all these things. You should create a boundary so that this bad day doesn't affect your good day at your home. So the boundary also has to be created. And the last but not the least, it's okay to say no, because when you grow, when you become, little experienced, many people want to involve you in the so many events, and then that will compromise your personal life. So it's absolutely okay to say no, because nobody should take it negatively if you are not available for a particular reason. So to summarize whole thing, how you can balance or how you can integrate your life and the work is by organizing yourself. It's just how we differently do it is going to matter in our work-life balance or work-life integration. Just to conclude, although there are several reasons for burnout, we are the one who are responsible for handling this situation. Nobody will come and help you out in handling this situation. Organizing ourselves is the key to success. Rather than creating strict boundaries, integration approach has shown more benefit and more feasible in our context. Involve your family member in the decision-making process regarding your work issue as well, because they are also aware about what are the problems you are having. Plan your weekends carefully. Try to maximize your weekend towards your family and combine your academic visit with vacation. Over the last 5 years, I have made sure that I always try to combine my academic visits to certain country with the vacation, so that we all together, family and the work. Thank you very much. Thank you.
you. That was amazing. And I love all your graphics. You need to do a tutorial on how to make those graphics. Those are a lot of fun. So for our next talk, we're going to hear from Michelle Moore, and I'm really excited that she's joining us today. We worked together when I was at LSU, and I learned a lot from her about wellness. And so I think we're all privileged to hear from her as a perspective from the clinical psychology perspective. Because as surgeons, I think we have one certain mindset and perspective. So it's going to be really great. And I really appreciate her joining us to share her insight.
Very good. I am very excited to be here. And as Anna said, I am trained as a clinical psychologist, but I have had the pleasure of being integrated into the Department of Orthopedic Surgery over here at LSU for the last 2 years. So I've gotten to learn a lot about how surgeons work and operate, and assisting them with faculty development and thinking more about professional development in a bigger context, and being able to work more with residents now too, and coaching and different things like that. So I'm excited about how this kind of aspect of the talk kind of rounds out the webinar, because I think it's a little bit of a different perspective, but it really builds on a lot of the wonderful concepts that you've heard already. So what I'm going to talk about is sustainable wellness and how to foster a growth mindset. So I like to start with understanding the difference between these things that we call self-care, which people refer to all the time. When you need to do self-care, make sure you're doing self-care, and how self-care differs from wellness. So I believe that self-care, these wonderful little things in the boxes up here that you see, those are important activities that you should have after a hard day, or if you know a difficult day is coming up. What do you do to take care of yourself? We just heard some wonderful tips about things that you can be doing that do contribute to self-care. But the thing I want you to be thinking about is another framework to be able to considering how this comes up with, which is thinking about it in 6 dimensions of wellness. So wellness is something that's holistic, that is really integrating all these different aspects of ourselves. And so it's seeing self-care as something a lot bigger. And what I like to think about is how we look at these 6 dimensions, and I'll go into them a little bit more detail, and how we see those aspects of our lives that come up in work, but that also come up at home, and how those things can be combined. And we utilize all of that to check in with ourselves and determine, am I well, right? How do I feel? A lot of times we're looking to see, am I getting to this place of burnout? But are we doing some self-reflection to check in with ourselves to question, am I feeling well today? If I'm not, what do I need to bring wellness into this day? So to break down these 6 dimensions, and we'll just do this briefly for the talk today, but when you think of your occupational life, this is one that comes up all the time. Are you satisfied at work? Do you like the structure of your day? Are your professional boundaries something that feel amenable for you to be able to do your job on a regular basis? Do you find joy in the work that you do? So if from an occupational standpoint, you're not in the setting that best suits you, is that something that you can change and adapt? From a physical standpoint, this is often one that we go to all the time, because physical wellness is usually one of the first things that comes up when it comes to self-care. So are you getting that movement and exercise throughout the day, just like we just heard? How are your eating habits, your sleep habits? When I talk to the residents, they're like, sleep? I don't remember what that is. How do I find that again? So how do you do in those aspects of your physical life? Your caffeine intake, your alcohol intake. Do you go to the doctor yourself whenever you have a medical issue going on? So how responsive are you to yourself? From a social standpoint, we just heard some great opportunities for social wellness and how important it is to have those connections. I would also add mentorship to this, right? That's an aspect of social wellness, is to feel that connection to your mentors, like we heard about. And what is it that you need? Some of us prefer to have alone time, and then others enjoy being in a group and connecting with other people. So what contributes to your wellness, and be aware of what that is. From an intellectual standpoint, activities like this contribute to intellectual wellness. Are you getting new knowledge in, something that really builds your way of thinking? Are you sharing and disseminating your ideas with other people? For some, that also can come through art, and not necessarily always through these more academic kind of spheres. But for a lot of us, we go into the academic work because it is intellectually stimulating, and it does contribute to wellness. Come to the emotional standpoint. Are you able to regulate your emotions? Can you identify what your emotions are? Do you have coping skills to navigate them? And then last but not least, the spiritual wellness dimension. So do you understand your meaning in life, right? Why are you here? Why do you do the work that you do as an orthopedic surgeon? Sometimes it's important to take a step back and remember the patients, right? There's a reason why I'm here, why I chose to go into this field, because I truly do feel connected to the work that I'm doing. So do you take time to reflect on that and really make sure you're connected to the meaning of your work, especially on the days when nothing really went the way that you planned and everything went awry? Do you go back to that bigger picture of really connecting with why you're here? So when I think of how do you attain sustainable wellness, so we have these 6 dimensions, how do we make them sustainable? The concept that we'll talk about next is this growth mindset. So being able to make adjustments and knowing that life does not follow a straight path and there are a lot of obstacles. Are you thoughtful in your decisions? Do you make intentional choices that are best for you? And importantly, turn off that autopilot mode. So don't just kind of float throughout the day. Choose to be present. Make sure that you're making conscious choices. And wellness doesn't happen overnight. Wellness doesn't just happen in the future. Wellness happens right now. So what are you doing for yourself today that's going to create this positive habit that can turn into something that long-term is really beneficial to you? And do you have this level of self-awareness to reflect on yourself and to really think about when you're off balance? So those symptoms of burnout we heard about, can you connect to when you're starting to feel burnt out? So a growth mindset. So Carol Dweck is a psychologist who talked about this, and she talked about a fixed mindset is when we tell ourselves, I cannot change. And a growth